Hi, Miss Chekroun. So today I have my two audience members behind the camera. I have my brother and then I have my sister. My sister's on the camera, so if it's a little shaky, it's because of her, okay? Alright, ready? The coronavirus, otherwise known as COVID-19, has single-handedly put the world on pause. This epidemic came out of nowhere, and it is the reason as to why everyone has to stay indoors and not leave their house. As you can see, the US was not ready to handle such a problem, and we're suffering because of it. I've done research on this topic, and I'm here to persuade you on as to why the US response to the virus was so ineffective. It was too big of a challenge, it seems. I will speak on the lack of resources hospitals had, and about how unclear quarantine orders really affected us negatively. To begin, the US didn't have the proper amount of supplies ready for the virus. There just wasn't enough product for purchase. According to the article titled, "Begging for Thermometers, Body Bags, and Gowns, US healthcare workers are dangerously ill-equipped to fight COVID-19. This is by Schlanger, published by Time on April 20th, 2020. These healthcare facilities were seriously unequipped, massively. Many had to beg for any type of material they can get, and I don't understand why. In addition, according to the article titled At War with No Ammo by Jacobs, Ritchell, and Baker, published by the New York Times on March 19, 2020, this is another case of how a shortage of PPEs negatively affected the medical environment. Healthcare workers were unprotected, so much so that the Open Cities Community Health Center in St. Paul, Minnesota is considering shutting down due to a lack of masks. Because of these lack of masks, a lot of medical places aren't testing, and testing is very slow because of it. A lot of doctors are having to work with loose or really expired masks, and it's not fair. My medical friend had to come to my house and had to ask me for some masks because his work didn't have anymore, and it just makes zero sense on as to why. According to the article titled Problems Met with Coronavirus Testing, Limiting Access and Sowing Confusion by Baumgartner and Carla Mangla, published by the Los Angeles Times on March 12, 2020, California is limited to testing because of a lack of resources needed. It makes zero sense. Why do they need all this type of resource for lab analysis? It just doesn't make sense on how unprepared the US is. As Jacobs and Fink explained in their article, How Prepared is the US for a Coronavirus Breakout, published by the New York Times on March 9, 2020, they said they've been preparing since 2005 for this type of virus, but why are they so ill prepared? It makes zero sense. Doctors are now having to make life or death decisions on who they can see. Because of this, many who need help aren't getting their help. According to the article titled, Why is it so difficult to get tested for coronavirus in the United States, by McGrath, published by Digital Trends on April 29, 2020, Dr. Mark Cameron states, why couldn't the US get ahead of testing for the virus as quickly as other countries did? And it's a very fair question. Once again, it makes no sense as to why the US wasn't able to immediately perform these types of tests. According to the article titled, Trump Invokes a Cold War Relic, the Defense Production Act for Coronavirus Shortages, by Wilma, published by NPR on March 18, 2020, someone named Jeffrey Bialos says it should have been put in place days ago, and I completely agree with them. Once again, the US was just too late on something. Why couldn't it come out sooner? Now I will speak about the tragedies that happened due to the miscommunication on quarantine orders. Because of this lack of communication, many were hurt. We are now number one in both deaths and people infected by the virus, and it's not a good title to have. It's only been 4 months since the first case of the US was found. According to the article titled, 4 months after first case US death toll passes 100,000, published by the New York Times on May 28, 2020. We found we are now at over 100,000 dead due to the virus, all because of the government's lack of instruction and discipline over quarantine guidelines. Too many people aren't taking this seriously, which is why we're still in quarantine to this day. It makes zero sense. According to the same article, we have now passed the amount of deaths in US combat fatalities since the Korean War. It just makes zero sense. And we've also matched the amount of deaths to the 1968 flu epidemic. It's absurd, really. According to the article titled 158 million Americans told to stay home, but Trump pledges to keep it short, published by the New York Times on March 23, 2020, Trump seems to not care for us either. He's thinking only of money lost, not lives lost. He says if it were up to doctors, we'd be in quarantine for months, but he says it'll be a short time. They can't seem to come up with a group decision. No one has a clue on what to follow. Oops. Sorry. According to the article titled Why the Worst Fears About Florida's COVID-19 Outbreak Haven't Been Realized So Far, this is by Scott, published by Vox on April 24th, 2020. There seems to be a plateau in both virus infections and deaths in Florida, yet I still don't believe that they're safe, and doctors also believe me. Too many people are still going outside to the beaches and hanging around together too closely, and I believe that they should be following the same guidelines as in New York. 28% of New Yorkers take public transport compared to the 2% in Florida, but I still believe they should be following the same type of guidelines. But then again, what are the guidelines? The US is having problems, but also is the UK. According to the article titled Quarantine and Physical Distancing Rules Are a Chaotic Mess by Star, published by The Guardian on May 14th, 2020, everyone seems to be having problems with communication on one way or another. She was told to sign some border control forms and was meant to turn them in later in, but she never did. She still has them. The US has had 15 years to prepare for this, and it seems like it just wasn't enough time. I've tried to persuade you on how the US's response to COVID-19 was so ineffective. They just weren't prepared at all. To recap, US hospitals had no supplies, and the government never came out with a proper stay-at-home order. I can't believe it. There are too many big-headed people in our society, and their choices affect us. I believe that if they were to have come together and come up with a cohesive group decision, we wouldn't have over 100,000 dead to our name. We mustn't think only about ourselves. We must think about everyone. After all, we are all in this together. Thank you.